Hey everybody, it's Coach Darwin here, and I wanted to show you how to correctly foam roll your IT band. So I was working with a client the other day who was presenting with symptoms of an IT band syndrome, which is really common among runners. So maybe that's you. What you experience is after a period of time, which could be 15-20 minutes, could be a little bit longer, but really exquisite pain on the outside of your knee here. And what is that's being caused by is this friction of this IT band rubbing back and forth through this repetitive motion. So that's why it doesn't happen immediately, and when it's at rest, it shouldn't be hurting after the inflammation has died down a little bit. Now, one of the ways that we can improve this condition is to use your foam roller to help create more extensibility in the IT band so it's not so tight and it doesn't cause that friction or that rubbing. Now, early on in my career, about 20 years ago, I was teaching patients how to do this completely incorrectly. And if you're doing it this way, I'm going to show you a better way to do it that's more effective and frankly, less painful. So just before we get to the actual technique, just understand that the IT band is a very fibrous connective tissue that attaches the muscle called the tensor fascia lata, or I'll call it the TFL, and it attaches this muscle in the front of the hip all the way down the side of the leg and attaches here at the outside, the lateral part of the knee. Okay, so what we want to do is use the foam roller to improve that extensibility. Now, I'll do it on this side here. So the way I used to teach this, which is completely wrong, and if you're doing it this way, again, please stop. You don't need to do it this way. So with your leg straight, and you're rolling the outside of the knee all the way to the knee on that IT band, you're going to notice it's very painful. Now, I went into the structure of the tissue because it's important to know that that fibrous structure of the IT band itself is not very extensible. So you're not going to get a lot of benefit by just mashing down on that IT band, and it's going to be painful for very little benefit. So here's what you want to do if you're presenting with this kind of condition, is you want to roll out that TFL, that muscle in the front of the hip right here. So you'll set yourself up in the same way this way with your affected leg straight. Your opposite leg is over top here to help control the motion. And what you're going to do from this position is just kind of roll your body forward this way. So you can see the front of my hip is now making contact with the foam roller. And you're just going to kind of roll around there, and you're going to know for sure when you're on the TFL. It's going to be painful, but probably not as painful as when you're rolling on the IT band. Okay, so you're just going to get in that position and just slowly roll back and forth, small little motions here. You can use this leg, you can use this hand to kind of help brace your body and slowly roll back and forth. So now that we're on the actual muscle belly itself, there's a better chance of it loosening up and causing the whole IT band to release and improve its extensibility. I like to roll for about 2 minutes. So if you're having IT band syndrome, give that one a try.